A stroke is a medical emergency that occurs when there is a sudden disruption in the blood supply to a part of the brain. This disruption can cause brain cells to become damaged or die, leading to a range of potentially severe physical and cognitive impairments. Here's a detailed overview of what a stroke is: its types, causes, symptoms, and treatment options. Types of stroke. 1. Ischemic stroke. Cause occurs when a blood clot or other obstruction blocks a blood vessel supplying blood to the brain. There's subtypes. Thrombotic stroke. A clot forms in one of the arteries supplying blood to the brain. Embolic stroke. A clot or other debris forms away from the brain, commonly in the heart, and is carried through the bloodstream to lodge in narrower brain arteries. 2. Hemorrhagic stroke. Cause occurs when a blood vessel in the brain bursts, leading to bleeding within or around the brain. Subtypes. Intracerebral hemorrhage. Bleeding occurs within the brain tissue itself. Subarachnoid hemorrhage. Bleeding occurs in the space between the brain and the tissues covering it. 3. Transient ischemic attack, TIA. Cause often referred to as a mini-stroke, a TIA involves a temporary blockage of blood flow to the brain. It does not cause permanent damage but is a warning sign of a potential future stroke. Causes and risk factors. 1. Ischemic stroke causes. Blood clots formed in the arteries supplying the brain or travel from other parts of the body. Atherosclerosis. Buildup of fatty deposits in the arteries can lead to clot formation. 2. Hemorrhagic stroke causes. High blood pressure can weaken blood vessel walls, leading to rupture. Aneurysms. Abnormal bulges in blood vessels that can burst. Arteriovenous malformations. Abnormal connections between arteries and veins. 3. Risk factors. High blood pressure, heart disease, diabetes, smoking, obesity, high cholesterol, a family history of stroke. As age, risk increases with age. Gender. Some studies suggest higher risk for women. Lifestyle factors. Poor diet, lack of physical activity, and excessive alcohol consumption. Symptoms of stroke. Stroke symptoms can vary depending on the type and severity, but commonly include sudden numbness or weakness in the face, arm, or leg, especially on one side of the body. Sudden confusion, or trouble speaking or understanding speech. Sudden trouble seeing in one or both eyes. Sudden trouble walking. Dizziness, loss of balance, or lack of coordination. Sudden severe headache, with no known cause. Diagnosis and treatment. 1. Diagnosis. Medical history and physical examination. Initial evaluation by a healthcare provider. Imaging tests. CT scans or MRIs to identify the type and location of the stroke. Blood tests to check for conditions that may contribute to stroke. 2. Treatment. Ischemic stroke. Administering clot-dissolving medications, thrombolytics, or procedures like thrombectomy to remove the clot. Hemorrhagic stroke. Controlling bleeding and reducing pressure in the brain, possibly through surgery. A rehabilitation. Physical, occupational, and speech therapy to help recover lost functions and skills. Prevention. Preventing a stroke involves managing risk factors. Control high blood pressure. Regular monitoring and medication. Healthy diet and exercise. Maintaining a balanced diet and regular physical activity. Quit smoking. Avoid tobacco products. Limit alcohol consumption. Drink in moderation. Regular checkups. Monitor and manage chronic conditions such as diabetes and high cholesterol. A stroke is a serious and potentially life-threatening condition that requires immediate medical attention. Understanding the types, causes, symptoms, and treatment options can help in early recognition and effective management. If you suspect someone is having a stroke, seek emergency medical help immediately. Every second counts in minimizing damage and improving outcomes.